Today, I have with me Dr. Kenny Handelman, who's the founder of Center for Integrative Mental Health. It's a specialty ADHD clinic. He is a psychiatrist for kids, teens, and adults. He is, of course, an expert in ADHD. He's also the author of a really good book called Attention Difference Disorder, and he has taught many doctors about ADHD in 22 countries across 4 continents. We had Dr. Kenny on the podcast a few months ago, where we discussed bipolar disorder, and today we have him back as the expert regarding borderline personality disorder and ADHD. Dr. Kenny Handelman, how are you doing today?
I'm great. Thanks so much. Thanks so much for bringing me back.
No, you can get a really good way of communicating these mental health conditions in a way that affects the ADHD brain and the person. And this one, I was really picking on who I was going to bring to the table about borderline personality, because borderline personality disorder I think is a highly misunderstood condition, and usually in the wrong context, or it's provided as a negative context. And I want to get that clarified, because there's a lot of ADHD people have, like myself, I was identified with some borderline personality traits, which we'll go more in a little more detail later. But can you start us off about what is borderline personality disorders, just so we can give context to the people?
Absolutely. So, first of all, I'm thrilled to be here. I'm so glad you're so authentic, share so much. And, part of the introduction we didn't talk about this time is I have ADHD too. So, I know about this condition from the medical and scientific side, but also I live with it. So, let's talk about borderline personality. Before we do, I just want to step back and think for a minute. What is a personality? We all kind of know that, right? We talk about personalities, but how would you actually define it? And when you think about it, like somebody important in your life, whether it's a best friend, a spouse, a partner, a child, a parent, if you say to them, if Andre were in this situation, how would he respond? And the people who know you well would say he'd do exactly this. And they're right? Because they know your personality. Our personalities are essentially a set of tools and strategies we use that help us to manage difficult situations or non-difficult situations, right? We have a set of tools to adapt to our environment. When we have good tools that are flexible, that allow us to adapt to many different environments, we have a well-functioning personality. If we have limited tools that lead us to have difficulties with others, trouble problem solving, have bigger reactions emotionally than we necessarily need to, we have difficulty with our personality, right? It's kind of like if you have a toolbox and you have a hammer's great for a nail. It's not so great for a screw. It's not
Yeah.
so great for, drilling into something, whatever, or cutting wood, but a hammer. But if you have only a hammer and you try to hammer everything, you're not finding the best solution. And that's what happens for a lot of people with personality issues. So there can be a broader category of personality disorders. And of course, borderline is one of them.
So I guess like going along with that analogy, then in a way that everything may look like a nail after a while, if we get into that habit of that personality, which is also a different pattern of thinking, feeling, or behaving. Is that a good summary of a personality?
Perfect. Yes.
Oh.
And yeah, so if everything is, I blame other people, nobody understands me, I have big, huge emotional reactions to any challenge in life.
Mm-hmm.
I have one hammer and I'm using it like a hammer, everything's a nail, but not everything is actually a nail. But I get upset and I struggle because I can't find the best solutions for different situations.
Right. So for the context of this conversation as well, personality can also be influenced by genetics or environmental factors, right?
Absolutely.
And those two together will definitely shape how the individual or us will perceive the world around us. And that's what the personality is. And
Yeah.
the listeners will know that I talk a lot about environment control. The environment has a big impact on ourselves here and behaviors.
Yeah. And when we think about borderline personality, so many people with borderline personality have a history of childhood trauma, adverse childhood experiences, multiple traumatic experiences, and the new emerging diagnosis of complex post-traumatic stress disorder.
Yeah.
And these sorts of things, especially at a young age, really impact personality development and really impact how people problem solve and react with the world. So yeah, environment matters a lot, genetics matters a lot. And as we're going to talk about soon, ADHD matters. But I want to define borderline personality for
Yes,
you.
please.
We're going down further, but I don't want to miss this. So the summary statement coming out of the DSM-5, our diagnostic manual, is an enduring pattern of instability in personal relationships, self-image, and affect, which is mood, and marked impulsivity. So the common symptoms in borderline personality are people who fear abandonment, have unstable and intense interpersonal relationships, very unstable self-image, feeling like I don't really know who I am, or that sort of thing. Impulsivity that can be very damaging, recurrent suicidal behavior or gestures, significant mood reactivity, chronic feelings of emptiness, and other things. And I will tell you, when we take everybody with borderline personality in the general population, it's roughly 1 to 5%. In outpatient psychiatric settings, it's about 10% of people. And in inpatient psychiatric hospitalizations, it's about 20% of people. 80% of people with borderline personality engage in self-injurious behavior, so self-harming, repetitive self-harm, whether it's cutting, burning, overdoses, etc. And up to 5 to 10% of people with borderline personality disorder end up committing suicide. This is the highest rate of suicide of any psychiatric disorder. It's actually shocking. So it's a very serious condition, very difficult. And as you said, there's a lot of stigma too.
Mm-hmm. How does borderline personality present or disorder? Yeah, I wrote the acronym backwards. It threw me off. Borderline personality. How does that present with ADHD? Or we talked this offline. I apologize. I used the wrong. I used offline. I hate that phrase. But anyways, I even hate green room. But anyways, before we started, we talked about how a BPD or a borderline personality can get misunderstood as ADHD. And this is what I really want to communicate here, because when I was diagnosed, I had borderline personality traits, but my psychiatrist, you don't have borderline disorder, borderline personality disorder, because I was still married. I still had company. So I had the traits, and that's what we had to work on. So what's ADHD and BPD? How does it overlap and why?
Yeah. So I'm particularly interested in why you have such issues with green room and offline, but we'll leave that for another discussion, Andre.
It's norm. That's what everyone uses. I just don't like to conform.
Believe me, I have my quirks, and if time we can go through them and have a good laugh, because we're all human and we have ADHD, right? But anyway, so look, when you have ADHD, many of us have focus issues, distractibility, we have impulsivity, and so many of us have emotion dysregulation as well, which means we have trouble managing and modulating our emotions to kind of handle them in a way that's kind of appropriate or functional, and it ends up interfering with our functioning because of emotion dysregulation. And a big percentage of us with ADHD have this. When you look at somebody with borderline personality, there's a lot of impulsivity to the point that it can be very damaging. There is a lot of emotion dysregulation, and there can be a lot of associated depression, anxiety, and other mental health conditions like ADHD as well. So there's a big overlap in the symptoms. When people just have, like, one way to think of a difference is in borderline personality, there are a lot of struggles with responding appropriately when stressed out. In ADHD, many of us actually do pretty well in stressful environments, right? Which is why a lot of people with ADHD become, EMS, first responders, emergency doctors, right? Like, the world is going too fast, and those of us with ADHD slow down and we're doing okay. Often, not everybody, but with borderline personality, there can be tremendous difficulty when there's stress. That's one thing where people with ADHD, we may struggle with thinking before acting, right? Which is a bit of a difficulty. In any case, there is a big overlap, and part of the concern, and it affects men too, but it's much more of an issue with women, that a lot of women with ADHD get diagnosed with borderline personality disorder, and the doctors don't, or psychologists or clinicians don't recognize the ADHD aspects as well. So This
Mm.
isn't to say, like, of course, I see people who truly just have ADHD. I see people who truly just have borderline personality, and I see people with both. And sometimes there are traits. I may be biased in the other way compared to a lot of other doctors out there, where I'm kind of biased to say, I don't really want to diagnose borderline personality unless it's super strong level of symptoms, like high level of symptoms. I would rather diagnose the ADHD, get treatment in place, and then if your emotional impulsivity and relationship difficulties and all that stuff starts to settle down with treatment for ADHD, well, I'm glad we didn't give you a diagnosis that really doesn't apply. Um, so yeah, it can be tricky out there, and it's hard to get a diagnosis of ADHD, and people just get slotted into this other category, which may not even apply.
Because a lot of the ADHD symptoms are on the list for borderline personality.
Yeah.
Emotional instability, mood swings, okay, fear of abandonment, like that's a big one, especially with RSD, rejective sensitivity dysphoria, but fear of abandonment, that's a very big one for me. Yeah, unstable relationships, impulsive behavior, self-harm, chronic feelings of emptiness. So they see that in the DSM and say it must be BPD. Is that fair to say that that person that they're that's trying to help them, and all professionals out there are truly trying to help everyone, are they knowledgeable enough in adult ADHD to make this misdiagnosis? Is that a fair enough assessment? I'm not trying to shit on anyone in the profession.
Right.
Everyone's only as good as what they know and
Yeah.
what they're able and what their expertise in.
Yeah. I think you make an excellent point, because in general, most psychiatrists do not have enough training in adult ADHD. And there are very frustrating situations where people, adult psychiatrists, respected professors of psychiatry at well-known universities, say it's not adult ADHD, it's just hard to treat depression. It's just borderline
Right.
personality. It's
Yeah.
just anxiety. And it's like, come on, how can you say this? How can you miss this? But it's also like, if they would just open their eyes, it's so gratifying to treat people with ADHD, because we get a lot better, not perfection,
Mm-hmm.
but so identifying the ADHD can make a big difference. But yeah, I mean, I think that the symptoms like avoiding abandonment, chronic feelings of emptiness, these are probably a little more on the borderline side than ADHD. But if you look at somebody growing up with undiagnosed ADHD and all the social problems that go along with that, all the difficulties with
Mm-hmm.
potential, and what you hear from parents, teachers, friends, and all the challenges that happen and everything, those can develop too with ADHD without full-blown borderline personality, right? So it
Right.
is tricky to tease it out for sure.
Well, okay, having you said that just triggered me. Well, sorry, I'm going to use that word. Anyways, it just got me connected to another thing here. You said before that borderline personality responds inappropriately when stressed. Is that
Mm-hmm.
the correct statement? While in ADHD, normally we respond very well in stressed environments,
Yes.
except for ADHD, except for when we are triggered, which would then trigger our
Yes.
emotional dysregulation, which is a whole nother topic for another day, because that's me. I don't think that's a true ADHD trait. It's just when you, anyways, I'm not going to go there. So if, to me, you're saying responds appropriately in stressful environments, but with ADHD, kind of like with the bipolar discussion we're talking about, ADHD needs to be triggered to a certain extent, while a lot of these other conditions are not necessarily triggered to have those effects.
Yeah, I mean, I'm not, I would need to think a little bit more about your
Mm-hmm.
statement to give a solid yes or no. I think the biggest point is it's really complicated, right? This is why hopefully you're seeing people are working with a professional who understands the nuance.
Mm-hmm.
Yeah, because those of us with ADHD have our emotional hot buttons that do get pushed or triggered in certain situations. Absolutely. And it's really hard to generalize, like, like even just my simple statements of, reacts while under stress or triggered under stress. Like,
Well,
it
I
really
think
depends on the person,
I think let's make a clarification here. I think it's a good point. We're not generalizing here. We're just trying to simplify it down to a
Yeah,
point that you, the listener, can take. Oh, hey, makes sense, yes or no, and then go get the more complicated
yeah,
discussion with the right people. So we're
absolutely.
not
Yeah,
generalizing here. We're just trying to simplify this complex condition, so that you can get a little more clarity, so you can make your own decisions from there and next step forward.
Well, and I know one of your most important points, and I think it's so important for people, is whether it's ADHD, whether it's borderline personality disorder or borderline traits, that does not define the individual, right?
Hmm.
This is something that is treatable. We all have our issues, our quirks. We're all human beings. We all have health stuff and mental health stuff, whatever. You just got to get the right help, understand yourself, and move forward. It doesn't define you. You are not stuck there because of it, right?
Yeah, because when I had my life tempest there, I believed truly I was a bad person. There's no way, hope in hell I can be saved. But what I never realized at the time with therapy afterwards, I just lost myself for 4 years. I was
Yeah,
always I'd like, oh, God, I've become a new person. And then someone says, no, you always were like that. So I just rediscovered myself in the process. And this is where, when I was told you have borderline personality traits, you have some anxiety traits, and just using that word traits, not saying you are depressed or you have anxiety or you're borderline personality, just traits that why. Now still looking at the why. And for me, it was a lot of the baggage from childhood trauma
for sure.
and all that stuff. But it takes honest, real work to figure all that out.
Yeah, and I think in ADHD, it's sort of you read online or you talk to people who are new to ADHD as doctors or individuals, you sort of have this amazing belief if I take Concerta or Vyvanse, everything's a lot better immediately.
You're right.
Well, yes, maybe, but there's also a big psychological journey and other things. But I want to make sure in our time we also talk about treatment for
Yes,
borderline
please. Yep.
personality as well as ADHD. So there are people who have ADHD, just ADHD, some people who just have borderline personality. There are people who have both, whether it's a combination of ADHD and BPD or traits.
Mm-hmm.
When it comes to borderline personality, one of the best treatments is psychotherapy, specifically a newer therapy called dialectical behavioral therapy or DBT.
Yeah, we've
And
talked a lot
so,
about that on the podcast. Yeah.
perfect. So that's a great approach, and people can listen to more episodes about that.
And I can tell you it works very well.
Excellent. Yeah, no, you know what? I think it should be taught in our schools so people learn
Yeah.
strategies to manage emotions, difficult situations, overwhelming things, etc. Really, why not beyond
Well,
mathematics and reading and writing? Why not give people skills to function in life,
and
right?
be assertive to and respect yourself is the other thing I got out of it. How can you be
Yeah,
assertive without being selfish?
excellent. Excellent point. The other thing is, so when people have ADHD and borderline traits, of course, treating the ADHD can be helpful. And there was a fascinating study that came out just late 2023, published from Sweden. I'm going to take a couple of minutes to explain this because it's really eye-opening and tremendous. So in Sweden, in the Scandinavian countries, they're able to do massive population-based studies, right?
Mm-hmm.
Because the government funds education, healthcare, prescriptions, and they have laws that allow them to do population-based research. So they followed 17,532 patients diagnosed with borderline personality disorder from 2006 to 2018. Now, they weren't going and meeting every person, they were looking at the database to study what was happening. And they looked at how well medicines worked. They found out that when people were taking benzodiazepines, so lorazepam, when people were taking benzodiazepines, so lorazepam, diazepam, like Ativan, Valium, things like that, when they were taking antipsychotic or mood stabilizing medicines like Abilify or Seroquel or olanzapine, things like that, and antidepressant medicines like Prozac, Zoloft, Lexapro, things like that, when they had borderline personality, there was an increased risk of psychiatric hospitalization. They also, those medicines were associated with all-cause hospitalization, so psychiatric or medical, as well as death. Mood stabilizers did not actually help, but ADHD medications helped with lower rates of future psychiatric hospitalization and decreased risk of all-cause hospitalization or death. So these are people with just borderline personality. They were not diagnosed with ADHD specifically,
Mm-hmm.
but or maybe some of them were, but if they took ADHD medicine, specifically lisdexamphetamine, Vyvanse, methylphenidate, so medicines like Concerta, Foquest in Canada, or there's
Mm-hmm.
other formulations in the States and other countries, and bupropion, which is Wellbutrin, the brand name, those medicines actually lowered the risk of rehospitalization and lowered the risk of suicide. This is dramatic. This is literally saving lives. And I think it points to that link of emotion dysregulation that's common between borderline
Mhm.
personality and ADHD. And I think targeting that with therapies like DBT, but also medicine for ADHD, literally is saving lives. And this is based on a population-based study of almost 18,000 people. It's incredible.
Yeah, so in a way here, treating ADHD, it be a borderline personality with ADHD medication
Yeah.
is affecting the BPD or the borderline personality person. So what I kind of got from this is, how about we just treat ADHD first anyways?
Yes.
Because
I
it's
mean,
going to have good results regardless. And if we treat the ADHD and the other traits or symptoms are still there, then you can go beyond.
absolutely.
It's like the other mental health conditions. We treat the ADHD, a lot of times the depression leaves or the anxiety
Yes,
leaves or
exactly.
reduces, because that's not the real
Exactly.
problem. That was just a
Exactly.
symptom.
Yeah. Yeah. I mean, probably most of your audience are people who are interested in ADHD primarily. So then hearing about this, by all means, treat your ADHD. It'll help borderline traits or borderline personality, plus get extra help. But if somebody finds this just looking for borderline personality, please talk to your professionals
Yeah.
about taking ADHD medicine. They can literally be life-saving.
Well, for me, I wanted to talk about this because majority of the time, a lot of other people I've talked to, borderline personality has always been discussed at one point during their ADHD diagnosis journey.
Yep.
So I just want to give people a little more education and understanding of the differences and how they are overlapped, so you can communicate effectively to your care provider.
Yes.
And with my experience, as long as I showed up with valid information that made sense, they were willing to listen, not just what I saw on TikTok or let's
Mhm.
just do this, right? This is what I'm hoping I'm helping people understand, get a little bit of better verbiage and clarity so you can have a better in-depth conversation as a partner in your mental health journey rather than just rely on that expert and give you all the answers. Because is this fair to say? Because you're in the field, right? Um, I'm an expert on me, you're an expert in the mental health, or in your case, the
Right.
ADHD and all that. So
Yes.
it's a two-way, it's a partnership. That's the way that's when I start getting a lot of progress with even my medical health, my mental health, and all that. Is I'm an expert on me. The healthcare provider is an expert on what they provide, and we're having a conversation to come up with the best solution.
Yeah. I mean, I think that's the best approach. I personally love it when I have that kind of working relationship with people. Um, Unfortunately, not all doctors love that, right? They want to say, I'm the doctor and be kind of paternalistic. But I think the field is changing for the most part
I believe so as well.
to be collaborative. But
Like for me as a patient, I had to be persistent as well, because I think I had to
of course,
overcome yeah, what the hell do you really know? Oh, you just saw this online. And I had to
yeah,
demonstrate that I was doing some research. I was looking at things, what's that word? Like constructively, not just
yeah,
hoping for a miracle pill.
yeah,
So it took time, but be persistent with consistent information and feedback, and they'll come around and start seeing that you're being serious as well. And you got to
for
try
sure.
what they recommend as well too. And the times I've come to compromises, I'll try your way and it didn't work. Okay, now I'll have to try yours. So,
Yeah, yeah,
so
excellent points. Very helpful.
um, I think we hit a lot of the points here. And like the one thing, like you really executed this well. Like for me, what I wanted everyone to take away from here today was that borderline personality are traits 9 times out of 10. I'm not saying not everyone like with ADHD may not have borderline personality disorder, but if we start looking at them as more or less as traits that were created by our brain to protect ourselves because of the environment or genetics, it doesn't define the real you. It's just, I think what I'm really finding fascinating is our brain will do whatever it can to protect us first. If that means I got to give you some borderline personality traits or some narcissistic traits, or maybe put you in a depression. So it's just there to protect you, but doesn't know if it's a positive or negative effect.
Yes.
And so that does not define the real you. And that's what I want you to understand. You got a little more information. Like Dr. Kenny said, personality is a lot to do with the environment and genetics, and it matters with your personality development. But what I like about personality is we can actually change personalities, either with mental health, professional help, environment change, new boundaries, systems, barriers, whatever. There's a lot of ways we can change the personality, but we got to take that first active step. And borderline personality, a simplification, responds inappropriately to stressed out times or environments, while the ADHD brain, it is very well in stressed out environments. And again, it keeps coming back. We keep hearing it's the environment. So, and that's where DBT does come a great factor. It does help us control or set boundaries and barriers to protect our environment, which will help with our mental health and assertively stand up for ourselves.
Yeah, so well said. Thank you.
Thank you. Any last words? And where can we find you and your Center for Integrative Mental Health?
Yeah, so I'm in Oakville, Ontario, just outside Toronto, and the website is cfimh.com.
Awesome. Any last words about this, Dr. Kenny?
No, I think just, well, I'll just say that if you have ADHD and some borderline traits, treat your ADHD and get psychological support. If you have borderline traits or borderline personality, talk to your doctor about the study we've been talking about. Talk about thinking about medicines that help ADHD because they help borderline personality as well.
All right, cool. And to you, the listener, I ask you, how many times have you made false assumptions on people's personality and not really reflect on what their environment may be causing that? Because if we start looking at it from that vantage and not react to their reaction, that creates a lot of empathy. And it's very important for everyone to start to be a little more empathetic about these negative, aggressive emotions, which are turning out to be more illegal now, but we're ignoring that these are valid emotions. And why is it being caused? I think is the next question we should be asking. So, Dr. Kenny, thank you very much.
Thank you, Andre. Great to be here again.
Yeah, and thank you. Thank you. And thanks for joining us again. And to you, the listener, thanks for learning with me as well again. Take care.